Announces a big shift in its COVID vaccination strategy, quickly doubling the supply of shots. Here to talk about the impact of that and so much more, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, thanks so much for joining us. Let's get right to it. Let's talk about this change. Why was the current administration holding back on doses? There were reports that they just wanted to make sure that there was availability for the second dose. And why release them now? Was there a lot of pressure?
Well, that's right, Maria. The reason they were holding it back was to make sure people who got the first dose were going to be able to get that second dose in 3 to 4 weeks. Now, if we release all the doses, we have to just make sure that the companies are able to manufacture more doses. So if you've received your first shot, you're going to make sure that you get your next shot within those 3 to 4 weeks. So really relying on the companies to manufacture it quickly.
The federal government also wants to expand the pool of people who can get the vaccine. So now where's the list, Dr. Ellerin? Where are we now?
Right. So the CDC just recommended that that patients 65 and older become a priority group, and also that people with chronic medical conditions who are younger than that. But remember, for people in our Commonwealth, we want them to go on mass.gov. That tells you where we are and what Governor Baker's plan is, because still for the next tier, it's 75 and older and patients with 2 or more medical conditions. So we'll have to see if there's harmony between those. But I think checking that website will keep people on top of.
Say the website again, please, so people can get it.
Mass.gov.
Very good.
The mass.gov website.
Very good.
So let me just say, for my 86-year-old father, who's not going on the computer and going to mass.gov, for people like him and people who don't do that, how do they know when it's their turn?
Right. So, Marie, we're still in that, tier 1, phase 1, where it's really frontline workers, the critical workers, and those in congregate care settings. So when we go to the next phase, it's at that point that if your dad's primary care provider or a healthcare worker doesn't contact him, then he'll want to reach out to his provider to see, if and where he should get the vaccine.
Governor Baker talked to plans today about at least 4 mass vaccination sites, and the first one would be Gillette Stadium, which is obvious because of its size. So let me ask you, this is a multifold question. What do you think about that plan? And will it be more effective than sending people, for example, to hospitals, pharmacies, to their doctor's offices?
So, Ed, both have to happen. Remember, Massachusetts has always led the way in medicine, technology, science. We have to be pacemakers here. So when it comes to COVID-19 vaccination, we want to set the pace for the rest of the country. Opening up stadiums like Gillette Stadium, that is a great place to start. We need to expand the number of places, the number of people who are going to be vaccinated, and and we have to make sure that we all accept the vaccine as well. I think once these things occur, we're going to be in a great place.
Dr. Ellerin, great talking with you.
Thanks, Doctor. Be well.
Have a good day.